I want to talk about addiction in this video really briefly, just a couple of minutes, and it's kind of a follow up to my history in 4 minutes or something, 4.5 minutes, the video I made last week. Um, so, in that video, I mentioned that I had, I had an addiction, and that I needed treatment for it. And I don't want to spend a lot of time focused on what my addiction looked like. I was a scumbag. Like, that's all I need to say. I was not a good person. I did horrible things that I'm not proud of, but I'm also not ashamed of anymore. But anyhow, that was over 30 years ago. I was treated. I spent a year in inpatient, and I did the 12-step model of therapy. And I don't believe everyone needs to do that. I didn't stay in AA or NA. I don't go to 12-step meetings, although I firmly believe that is a path to enlightenment, to being a better person. But I don't think it's the only path. So I found all of that very helpful, and I needed it. I feel like I needed that when I entered addiction treatment. I spent a year in treatment, and I've been back to counseling since then a number of times for not for addiction per se, but for issues related to how I was functioning as a human person. I just want to get into some of the things that helped me besides addiction treatment and besides the 12-step program, which I'm an advocate of. If you have an addiction issue, I think you should at least give it a try, and maybe more than one try, maybe 10 tries. Who knows? Maybe it will be helpful to you. But probably the biggest thing, and the thing I spend the most time talking about today, because I think it relates to every disorder, is the idea that you can't trust your thinking, that you have to question your thinking. In the excellent, outstanding book, The Subtle Art of Not Giving a Fuck, he says you have to create doubt. You can't be so sure that you're right all the time, because we're wrong a lot more than we think we are. And with that, the kind of the recovery model, or what they teach you in addiction treatment, is that you have a disease, you have a disorder, whatever you want to call it. Okay, whether it's, and I'll get into this again when I talk about depression, maybe later. But you have an addiction. The addiction takes over some of your thinking, and you can't trust your thinking because your addiction wants you to use drugs, and that has control of a part of your mind, and you just can't trust it. I feel like that has been the most beneficial thing to me, and realizing substances weren't an option. Like getting to a point in my life, maybe while in rehab, that using, no matter how bad I was feeling, no matter what was going on in my life, it just wasn't an option. Drugs weren't an option. Alcohol wasn't an option. And I wanted to talk briefly about the recovery model. It's being used for other things now, and hopefully I'm going to write something about that eventually. One of my colleagues and friends, Jessette Tharp Smith, Dr. Jessette Tharp Smith, wrote a really good article about how the recovery model was being applied to post-traumatic stress disorder. And a big part of that model is accepting you have a disorder, accepting it affects your thinking, you can't trust your thinking, getting sober support, social support. In the case of addiction, it would be sober support, but social support. Finding purpose and meaning in your life, vocational rehabilitation, a number of things that kind of support these changes that one that has an addiction or post-traumatic stress disorder, or in my opinion only right now, it hasn't been empirically supported, but just about any mental health disorder this could be helpful with. I think that's what's helped me the most, and then other things like taking care of myself with exercise, and diet plays a certain part, although that comes and goes with me. But I eat a whole lot healthier today than I did 20 years ago. So I'm still far behind a lot of people in healthy eating, but at least it's progress, not perfection, they say. All right.